So we're hearing a lot about post-traumatic stress disorder, and we're joined once again by Dr. Shimi Kang, a frequent guest on the show, a psychiatrist and an author. So describe it to us.
Post-traumatic stress disorder. So the word actually helps because it happens after a trauma, and the trauma is an experience where there's a perceived threat to life. And it puts an individual in a threatening place. We call it freeze, fight, or flight. The freeze is the anxiety. You're frozen. You may not get out of bed. You certainly aren't progressing forward in life. The fight, irritability, anger, violence, aggression, and the flight can be things like drug and alcohol use, escape, leaving one's home and family. So these are some of the core symptoms of post-traumatic stress disorder, and they don't happen to everyone who has trauma. It's actually a smaller percentage of individuals who experience trauma.
Now, in this case, we only know that Corporal Francis had PTSD because he said so publicly. He said that's why he wanted medical marijuana. We heard from his commanding officer that, in fact, he was linked to PTSD. That's all we know. So I guess we have no way of assessing what else may have been going on in his life and what else may have contributed to his suicide.
Yes, we don't know those details. And one thing I want to point out is that for individuals who are RCMP officers or soldiers or who have chosen a profession out of all the professions to protect and serve, this diagnosis is really difficult psychologically because there's a disconnect of identity. And that individual saw themselves as brave, as protecting, identified with the uniform. And when they have these difficulties, it's hard for them to carry forward that particular profession, and it can be even more devastating.
And he may have made it difficult because maybe one of his symptoms was he was in a fight with the RCMP. You know, defiantly he was smoking medical marijuana in his uniform. There was a struggle when the Mounties tried to take his uniform back. I guess different people react in different ways, and sometimes the way they react might push away those who either want to help them or at least should be trying to help them.
Absolutely, and we definitely see that for a lot of these types of conditions. There's a lot of anger. Individuals, like I said, have lost their identity. They've lost their status, their belief in the system as well if they've been disappointed, and that can bring out all kinds of reactions. Drug and alcohol problems are common, and also the feeling of isolation, that I'm alone. No one really understands what I'm going through.
I remember when PTSD was only used in reference to soldiers, and particularly the Vietnam War. Now we hear it in many other settings. I assume that you know, when doctors use that term, it's not used loosely. There must be a very specific clinical diagnosis before you get to use that term.
Yeah, there is more awareness, so we are hearing about it more, but the actual diagnosis hasn't changed. The criteria is the same. You have to have an experience that was traumatic, followed by those symptoms that cover are either anxiety, depressive type symptoms, the anger, the hyper startle, the phone rings and you feel threatened, and then that kind of escape type of symptoms. And they have to impact your functioning, your day-to-day functioning, your work life, your home life.
Shimi Kang, a psychiatrist and author, thank you very much.
Thank you.